Hey guys, I don't think I could possibly be more excited for this video that I have for you here today. I'm here with Dr. Will Bostock. He's the director of Cambridge Progressive Medicine over in the UK, and he has a special interest in functional illnesses such as chronic fatigue syndrome, ME/CFS, fibromyalgia, chronic pain conditions, long COVID, and so forth. And he also runs a publicly funded long COVID clinic that is currently in the process of expanding and revamping so that it can serve other functional illnesses such as chronic fatigue syndrome. And his approach, I think, those of you watching, you're going to really appreciate because it really resonates with what a lot of us are seeing that is actually helping and working with people for recovery. So, Dr. Bostock, thank you so much for being here today.
Well, thank you very much for having me, Raelan. It's a real pleasure.
Yeah, you and I had a chat the other day through Zoom, just not even with the intent of having a video or anything. And I thought the conversation was so amazing. I wish we were recording this. It was just like people would so love to hear this. It's so validating for one to have someone, a doctor, from our conventional Western medical system who, not only understands, believes that those of us with these sorts of illnesses, it's legitimate and we are sick, but you actually do have an approach to recovery that is working for some people. So yeah, just really exciting stuff. Before we dive into some things, and I already know what your answer is going to be, but I think it's important to talk about this and to say it. So in your experience with conditions like long COVID or chronic fatigue syndrome, is recovery possible?
It's a more controversial question than you would think. Right? So, all I would say is that my special interest is in persistent physical symptoms or functional illness. Now, I think the question about whether ME/CFS is a functional illness is a very, very complicated one. And so, what I would say is that I think that recovery from a functional illness is definitely possible. All right, whether all people with a diagnosis of ME/CFS or long COVID have a predominantly functional illness, I think, is a different question. All right, and I think the truth is that we don't really know those conditions. We have a bit of a problem with our definitions. So if you take long COVID, for example, the way we define long COVID is that you have persistent symptoms, and you can choose from any of over 200 symptoms 3 months after having a coronavirus infection. And here in the UK, it's at least 80% of the population have had coronavirus. So what that kind of means is that if you've got persistent symptoms for more than 3 months, you can call that coronavirus. And I think it's challenging to assume that everybody who receives that diagnosis has the same underlying problem that's creating those symptoms. So in my long COVID clinic, I'll see, the first patient I'll see will be an 18-year-old with brain fog and fatigue, and then the next patient's a 70-year-old with all over body pain. And to assume those people have got the same fundamental underlying pathology, I think is a stretch. So what I would say is that we don't know for certain with these conditions exactly what's going on, but I think a lot of people that have an underlying functional problem end up with these kind of diagnoses because we don't have clear diagnostic markers, we don't have biomarkers, and the diagnostic criteria basically is based on symptoms. So I would say that it's not a straightforward answer, and I think we do need to be very careful because for some people in the CFS-ME community, the whole concept of recovery can be problematic for them. So I think we need to be very, very cautious. So what I do in my long COVID clinic is that I look at patients with an open mind, and I see whether there are features there that are suggestive of a functional illness. And in my experience, people can recover from all sorts of things, and we don't know what the capacity for human recovery is. All right. So what I would say is that flip it on its head. I would say that it's not. We don't know that people can't recover, I think, is the way that I would say it. All right. So I don't know if that's quite what you're expecting me to say. But, I just think we do need to be very cautious about it. Obviously, recovery is possible because you've got over 75 videos of people that have recovered, right? So I guess some people from the ME/CFS community might say, well, that might mean that you didn't have ME/CFS in the first place because they don't think recovery is possible. And so then I would say then the question is, if you're someone who's suffering with a complex illness like this and you've been given a label of ME/CFS, maybe that diagnosis isn't right, right? And we don't know. There's no way of proving that. So I think everybody has the potential to recover. Whether or not it's possible for any individual person, I don't think that we can say for certain. Does that make sort of any sense?
It does. And I
Yeah.
ask it because there is a lot of information out there that says once you receive an ME/CFS diagnosis, you are doomed, essentially. There
Yeah.
is no hope for recovery. Learn to live with it. And my understanding from what I'm seeing, and at least from a bit of what you're seeing, at least with some people, is that's not the case. So I'm always working on this channel to try and
Yeah.
shed some light on these statistics that are out there that I personally don't think are accurate, that no one can recover, or that virtually nobody does. So but I do appreciate that it's not a black or white situation, and there's aren't blanket
Well, I
statements
just
that
think
can
that
be made.
I suppose the thing is that not everybody with that diagnosis is going to have the same problem. And
Yeah.
for some people, there's going to be diseases that we don't know about yet, right? For sure, there's diseases we don't know about yet. And so I don't think we can make sort of blanket statements. But what I think is that functional illnesses are absolutely real. They're very, very common, and we know that people can recover from functional illnesses. So then the question is, does everybody with that diagnosis have a functional illness? Well, we don't know. But what we can do is, with a fresh set of eyes, have a look at the presentation, have a look at the symptoms, and see if there is a functional component. I guess we need to sort of explain what we mean by this, really, to understand what we're talking about.
Yeah. So what is a functional illness? What qualifies something?
Yeah, so
to be
that's a
that?
good question. So there's lots of different names for it. All right. So I use the term functional illness. Some people use the term persistent physical symptoms. In the US, people use TMS or PPD. Some people say central sensitivity syndromes. But all these, they're describing the same set of conditions in a way. So I think it helps to sort of explain how I came to be interested in this. So I was an A&E doctor, and I had before I did general practice, and I had a very set biomedical view of what meant someone was healthy or sick. So from my point of view, if your shoulder was dislocated, you were ill, right? And you come in and see me, I'll put the shoulder back in, and I've restored you back to health. And then in 2016, I had a big career change and went out into general practice, and people coming and see me with shoulder pain, and I'd do an X-ray and it wasn't dislocated. And so then suddenly I saw lots and lots of people that were ill, and they had loads and loads of symptoms, and I'd do a whole load of medical tests, and I couldn't find a disease to account for that. And so I got very sort of interested in trying to understand what was going on there, because clearly the people were ill. Like, it wasn't, so there was something going on, and we couldn't really put our finger on it. And so since then, I've been really trying to understand what that means. So I guess, like, in the most basic term, you'd say it's a illness without a disease. Now, you've got to be very careful with that. So you have to be very clear about what we mean by disease. So I'm using a very narrow definition of a physiological, like a biochemical, physiological fault that we understand and know how to fix, basically. And if you haven't got those things, then the medical toolkit that you've got isn't very useful for the problem that you're dealing with. And so you have to start thinking a little bit more broadly about what might be going on. And actually, there's a whole range of kind of named conditions that fit into that category. So irritable bowel syndrome, functional neurological disorder, chronic primary pain syndromes, some fatigue conditions. And they sort of have a pattern in that you have persistent symptoms, and when you do the blood tests, they all come back normal, and then you're sort of trying to understand what's going on then. In the last sort of 20 years or so, there's been a lot of developments, especially by the neurologists in functional neurological disorder, and also by the pain scientists, in understanding what's going on and why we see that pattern. And so broadly, the way I like to describe it to patients is that if you imagine that your laptop stops working, there could be two main things that could have gone wrong. So you might have spilled a cup of coffee over it, and you fried all the wires inside. And in that case, if you unscrewed the top of the laptop and had a look inside, you would see all those fried wires. And so we call that a hardware problem. It's a problem with the structure of the laptop. But equally, you might be finding your laptop's not turning on, and it's because it's got a software problem. It's got an internal fault in its programming. And in that case, if you take the top off and look inside, it will look completely normal. And what we think is that humans are basically exactly the same. We've got our hardware, we've got heart and our plumbing and our muscles. But we also have an internal program that controls all of our systems. So there's a reason why our heart beats at 60 beats per minute when we're asleep and 100 beats per minute when we're like going out for a run, or our bowels move very, very slowly when we're on the bus, but like if we've eaten a big, I don't know, eaten something that's not good for us, they move very quickly, so there's internal programs that are controlling those things. And what we think is that those internal programs can develop a fault, and just like with the computer, if you've got a problem with that internal programming, when you look inside, so you do a chest x-ray or an MRI or a blood test, you can't see where that fault is. So broadly speaking, that's what we think is going on. We think that these class of illnesses are essentially a different type of illness, in that they're a fault in that internal programming rather than in the hardware. I don't know if that makes any sort of sense.
It makes a lot of sense, and you just explained really well what we talk about a lot on this channel, and people who come on the channel talking about their recovery, when they talk about they used more of a mind-body approach, is what I'm understanding, to their recovery. So it wasn't, fixing through supplements or pills or surgery or anything like that. It was through, working with their nervous system, doing some sort of brain training, whatever it might be. It looks like different things for different people. But I think that's what I'm hearing from you, that for some people that this is the case.
Well, I suppose what I would like to clarify with that, because some people, when you talk about hardware and software, they think of that as a difference between a physical problem and a psychological problem. But I don't think that's quite the right way to think about it, because we're not talking about the difference between psychological and physical. So actually, your psychology can impact both your hardware and your software. So we talk about a stress ulcer, right? So you've got a stress in your emotional life, and that causes an ulcer in your stomach. It's a well-documented medical issue. Now that ulcers are a hardware problem, so we know that our emotions and our human lives impact both the hardware and the software. All right, so it's not the case that these software problems are predominantly psychological. They're like internal body systems, basically. And I think that's quite an important thing to understand, because some of this work, it came from, traditionally they were sort of called like psychosomatic illness. Now we've moved away from that term now, because it doesn't represent the sort of new neuroscience that's coming through, that's helping to understand what's actually going on. And so it doesn't really make sense, because a stomach ulcer that's caused by stress is sort of psychosomatic. Like psycho is your mind, and your somatic is your body. So like I don't think that's quite the right way to understand these things. And so for me, I think understanding that when you've got a problem in your software, that's not a conscious thing. You're not choosing to be ill, you're not imagining it, the symptoms aren't the symptoms are absolutely real. It's just that the type of problem is at a different level in your internal systems.
Yeah, when you first reached out to me, I remember we were talking about, or you had mentioned that we were coming to some of the same conclusions about recovery, but we were coming at it from different ways. Because I talk to only people pretty much who have recovered, and you, of course, are seeing people who haven't. That's the reason they come to you. So your focus is more on some of these stuck points, you said, on what is keeping them from recovery. And potentially, because there is controversy around this, it's not fully understood, or at least even what we do understand is not common knowledge yet around this. The mind causing physical symptoms, causing all of this. So can that be, or is that potentially a stuck point for some people, because it is so controversial to even understand our bodies in this way?
I think it absolutely is. I think that we sometimes fall into the trap of having almost like a hierarchy of illness. So people, it's almost like a hardware problem is more deserving of love and care and compassion, and is more real than other kinds of problems. And for me, that makes absolutely no sense. If your computer doesn't turn on because it's got a computer virus, it's not just stressed, right? It's not pretending not to turn on. Like it's an internal fault in the system. So it's sort of about understanding the complexity of human beings, and that actually the things that make us well or not well are not black and white, and they don't follow really simple causal mechanisms. So we can't understand human beings at that biochemical level. And so So the way I think about it most broadly is basically Western medical diseases are not the only thing that can make us ill. That's the sort of biggest message. And I think that we need to be able to be compassionate if we are, like, I don't think it matters what type of illness it is, whether it's a hardware problem or a software problem, or even if it's a psychological problem or whatever. Like, we need to be able to be compassionate to ourselves if we're not where we're meant to be, and when we're struggling, and when we're ill, and when we've got symptoms that are stopping us from living the life we need to lead. Like, we have to be able to be compassionate to that, regardless of what the underlying mechanism is. And I think that this narrative is moving away from that kind of psychosomatic concept helps us to understand that, you know, these are absolutely real conditions, but we need to think about them more carefully if we're to be able to access all of the things that might be able to make an impact to help us to recover. So I think it is really important. I guess I suppose what I would say is, specifically for these, I think in order to sort of help to understand a bit more what I'm trying to talk about, it's not just a software problem. So what we think is that very specifically, it's a problem with our internal warning systems, often for a lot of these conditions. So so you already mentioned sort of fight flight. I know you've talked about this a lot in your videos in the past. Essentially, for me, if we want to understand where a symptom's coming from, we need to understand what a symptom's supposed to be doing when it's working, how it's working properly, right? And essentially, symptoms are a warning system. So they're the way our body is warning us that we might be in danger. And so the analogy I often use is that if you're driving along in your car and the check oil light comes on, and you pull into the garage and they have a look at the engine, and there's plenty of oil, it might be that there's a problem with the light itself. So we think about it, it's a activated warning system. So the symptom, the pain or whatever it is on, but the problem is within that symptom producing system or software, rather than in the area where the symptom is coming from. And again, I think it's really, really important to understand that doesn't mean that it's all in your head. Like, if your check oil light is on, you're not hallucinating. Like, you're not imagining it. The light is just as bright. It's just as real. It's just that the level of the fault is in a different problem in the system. And so I just think understand that can be really powerful. Partly to know that our body is safe, but also to understand how that can happen and why. And, you know, because when we understand that, it can help us to find new approaches at trying to do something about it.
I think that's such a good way to understand it, because it's a difficult thing to explain and to understand and wrap your head around when you're sick, especially when you've spent your whole life not thinking about symptoms in this way. Why is my body making me feel sick if nothing's wrong? How can I be feeling this bad? Or not if nothing's wrong, but if nothing is structurally, physically, like I have this pain in a certain part of my body and you're telling me that there's nothing actually structurally wrong with that part of my body. How can that be? So I think that check engine light is such a good way to think about it, because it's a tough thing to wrap your head around, especially most of us have very little medical training and virtually zero awareness of this way of understanding our bodies.
I think you're right. I think something is definitely wrong. So I say to people, you know, like,
Yeah.
it's not that nothing's wrong. There's definitely something wrong. Like, when your check light oil's on, there's something wrong, right? So, and I think, again, the same thing. Like, how can my body make me feel so unwell? I guess the thing is that the severity of a symptom is actually quite a poor representation of what's going on in the body. All right, so you can have very, very serious diseases that have no symptoms at all. All right, and then you can have other times you can have very, very severe symptoms, but the hardware is actually okay. And so it's just not a very good predictor in medicine, actually, because the body's producing symptoms all the time. So, you know, my favorite statistic is that the average person has 5 new medical symptoms every single week. All right, so they did a study in New Zealand. They just rang them all up one day and said, "Oh, have you got any symptoms?" And so 5 a week on average. Only 10% of people can get through a single week with no medical symptoms at all. So our bodies are producing symptoms all the time as part of the normal way that they function. And then what can happen is that system can get dysregulated. So the symptoms are very common. It's much, much less common for them to be persistent. So that's where the problem. It's not really that the symptom shows up, it's not going away, because everyone wakes up one day and says, oh, I feel rotten today, I just need to have a bed day, right? But it's okay, because it's okay the next day, it's all right. But if it's not okay the next day, or that you've got pain that's going on and on and on, then there's a problem. And the way I think about that, symptoms are there to keep us safe. That's their job, right? So I always say, if you don't have pain or you don't feel symptoms, you won't be very healthy, because you won't know when you're injuring yourself, and you're going to get into trouble. What that means is, if you're getting a symptom that isn't improving is not keeping you safe and isn't helping you to live a good life, then there's a problem with that symptom. You shouldn't be getting it, right? So your body doesn't want you to feel symptoms that aren't improving your survival. So, there's this classic thing, isn't there? Like you're chasing a deer and you twist your ankle, and your body's going to give you pain, because if you walk around on that ankle, then it's going to damage it. But if you're exactly the same injury and you're running away from a lion, the body's going to say, well, we don't need to give you any pain, because you're going to get eaten by the lion. So it's not in your interest to have that pain. And so this concept that your body is calculating whether to give you a symptom, not just based on signals from the body, but also on the broader context of what it thinks is going to keep you safe and is going to lead you to lead the life you need to lead, then you can sort of understand how lots of different factors can mean that your body's going to start producing symptoms excessively or when it shouldn't. And I think understanding the way that's working is very, very valuable. I understand that it's not in your head, you're not making it up, you're not like it's not like volitional, like it's not something that, these are all internal hyperactivated warning systems. And with newer techniques, we're starting to really understand how these systems work, and to start to understand the way that they can start to get dysregulated. So especially in the field of pain science, there's lots and lots of research into they can make people feel pain in rubber limbs, they can make people feel pain in other people's limbs. So there's quite amazing things that helping us to understand what the brain is actually doing, how the brain always produces symptoms. Like, it doesn't, like, whatever the problem is, if you hit your thumb with a hammer, the pain's not in your thumb. Like, your brain is producing that pain based on its context. And I think that's very important.
Yes. One really important thing that I pulled out of that, because I can't even begin to count how many people I interviewed who fully recovered, but at some point during their time of not being well, 100% thought that they were going to die. Their symptoms were so severe, there was no other conclusion for them to draw than I must be dying. Like, there's no coming back from this. So that understanding that the severity of symptoms isn't necessarily a reflection of the severity of what's going on in your body, I think is just such a wonderful thing to know, because in those moments it can feel like, how am I ever going to come back from this? This is so intensely bad. And quite a few of those people did recover once they found what worked for them fairly quickly. So it wasn't that it took them years and years to slowly work themselves out of this. So again, the severity of the symptoms also didn't necessarily correlate with the length of time required for recovery, which I think is really good.
Yeah. And there's some types of symptoms that are particularly like horrifying. So there's a very simple condition called BPPV. So that you get a little crystal in the inner ear, and it swells up the fluid and moves the little hairs around. It gives you this dizziness. But when it's a simple medical problem, and you can treat it just with a sort of maneuver to move the crystal out of the ear. But the symptom you get, that sort of vertigo symptom, it makes people feel like they're absolutely going to die. Like, it's an awful, awful symptom. So it's like you say, it doesn't map very well, you can't tell how dangerous things are in your body from the way it feels. It's like back pain, like acute back pain, can be absolutely horrendous, and the body will heal it. The body will just heal that. So I think it is an important thing to understand. But I guess also, I think understanding that your body is safe so that you can engage with the types of rehabilitation treatments that people use to recover is also a very important thing. And I guess from my point of view, when we think about functional symptoms, so traditionally we used to talk about like a diagnosis of exclusion. So you've got a functional problem because you do all the tests and you check you haven't got any, like there's no other disease to account for it. But more recently we're trying to move away from that, because what we're thinking is there's typical patterns of symptoms that are suggestive of a activated warning system rather than something in the body. So so if we go back to the analogy of the light coming on in your check oil light, if the light is flickering on and off again, or if it comes on every time you press your horn, you think, well, that's probably not going to be a problem with the oil, because the oil is not going to be filling up and going down, or filling up and going down. And so when you see a pattern like that, you say, well, that looks like a warning light problem. And it's exactly the same with people and with symptoms. So, like, for example, if you've got symptoms that are moving from one part of the body to another, so you've got a pain that starts in your shoulder, and then the next day it's in the knee, and then it's symptoms that are all down one side of the body. So you've got itching all on one, like all of your symptoms are on one side, headache one side, itching the same side, symptoms that are coming and going, like cycling quite rapidly, like you have good days and bad days without any clear explanation, or also symptoms that sort of triggered by things that you wouldn't expect to trigger it. So it's like every time I get to the third mile of my run, my knee starts hurting, and then after the fourth mile it disappears. So when you've got like patterns like that, these are suggestive that it might be a problem with a software programming hyperactivated warning system issue. So that's what I was sort of referring to, when I was saying thinking about ME/CFS diagnosis or long COVID diagnosis. I think probably these people haven't all got the same thing, but when I see people in my clinic and they have these very typical patterns of symptoms, then you can say, yeah, this does look like this is what we think is going on here. Like this is the science behind how this is happening. This is the new neuroscience of how we understand it. It's triggered, and here's some evidence-based things we can do to reset that system and calm those warning systems. So I think sort of making that positive diagnosis, recognizing that there are clear patterns that point towards these types of illnesses is a really important step. At the same time, like validating these are real things. Like this is a real illness. And there's things that we can do about it.
I'm curious from your perspective as a physician, how common. Okay, here's where I'm coming from. So I'm thinking about everything you're saying makes total sense to me, and I suspect it makes total sense to virtually everyone who's watching right now. But I was interviewed by one doctor on a channel, and I was explaining some of, maybe not quite as well as you're explaining, but similar concepts, and I felt like it was just coming across like it was just all woo, or I was just sort of making things up. And I suspect most of us, if we go to our doctors in the conventional medical system, like I'm just wondering how, because I know I've been doing a ton of research on this and I've seen it so much. This is backed by science. There are brain imaging studies and all sorts of things. We have way broader, different understanding of pain and chronic pain than we did 10 years ago, 20 years ago. But it takes a while for that to trickle down into mainstream society. So I guess I'm just wondering, how many people do you think will go into their doctor's office and will be able to have this conversation? Like how many? I think you know what I'm trying to ask here. Like, are there a lot of doctors that come at healing from this approach?
Yeah. So what I would say is that we've known that medical diseases aren't the only thing that can make you ill forever, right? So like so this biopsychosocial approach to medicine's been around, so I think most doctors do understand that other aspects need to be taken into account. I think specifically thinking about activated warning systems, maybe less so. So in last year, I went to a big conference for long COVID. It was for the whole of the UK. And there was not a single mention in that conference of sort of mind-body medicine or functional illness at all, like the entire day. So this isn't mainstream. I think there's some resistance to it in certain patient population groups. So some people, because of the all in your head sort of misunderstanding, I think some people can be resistant to it because of the hierarchy of illness. I think it's complicated because I know that sometimes like health insurance and things can play a role, like depending on what type of illness it is. And I think really we need to be moving away from that. Most of my colleagues, like in general practice, I think understand it because it's so it's incredibly common. Like so, 5 new symptoms every week, but that's not the same as functional. They're just symptoms. But actually, they think that about a third of secondary care clinics are for functional illnesses. So in each specialty, so a third of neurology referrals have functional neurological disorder. A third of gastroenterology referrals have irritable bowel syndrome or functional dyspepsia. In some specialties, it's higher. So in obs and gynae, 66% of people that are referred to an obstetrician, a gynecologist, let's say. In obstetrician, the obstetrics is a bit different. But in gynecology, 66% never find a cause for their symptoms. So that doesn't mean that there isn't one, because obviously there's an element of there can be undiagnosed diseases. But I think there's a huge amount of this around. It's ubiquitous, basically, because it's how our bodies work, like it's how our bodies function, and so. And I always say it's like Sod's law. Like, we know that these systems exist; they have to, because we work. We're in we're functioning in the world, so these systems have to be there. And if a system exists, it can go wrong, and it does. And I think being able to recognise the patterns for it is important. Maybe it's getting more. I don't know. Sometimes I think it's getting less, and I actually think that I think that the patients are leading it, actually. So I think that. People like you putting out content like this is the thing that makes the biggest difference. Because it's one thing me saying it, but it's quite another thing hearing it from someone who's been through it and has recovered from it. And I think that it's going to be driven by the patient voice, actually. I think that's where we're going to see it moving.
That's an incredible thing if we're driving in the right direction. I think that's really empowering for all of us to hear that we have, because I think we can feel quite powerless in all of this. And so many people that I interview and talk to are frustrated and they're like, how do we get this information into our doctor's office? So it's nice to know that we have that potential influence, but also, cognizant of what that influence is. Is it resistance to these things? Is it embracing? Is it, what are our loudest voices and what are they saying?
Yeah, absolutely. I mean, I think focusing on recovery stories is such a powerful thing, because if we want to know how to get better, then we need to talk to people who have done it, and then I think it's so important. So going back to this thing, like, can anyone recover? I've seen people that I thought were never going to get better. Like, it's just no way. And they completely, all the symptoms go away, and it's just incredible. So I used to, when I started doing this work, I would sort of pick, like, oh, this person looks like they might respond to this way of talking about it, and so I'd sort of just choose who I would talk to about it based on whether I thought they were going to respond or not. And actually what I found is that I wasn't always able to predict it. And some people who I sort of shied away from talking about this, because you have to be careful, honestly, because you can get complaints, because for some people this way of framing it doesn't make sense for them. And for some people they feel like it might be harmful for them to sort of think about recovery at all in certain conditions. And so you have to... You are a bit cautious about how you approach it, because it can upset people and you can get formal complaints, and that can be challenging. But what I've learned is that it's not for me to predict. I can plant a seed, and then if it resonates with people, they can take that away. Because I always say that doctors don't make people better at all. Like, we just don't have that power. So the power of recovery is inside each individual. Like, I really, really believe that. I think it's sort of a central tenet for me of recovery, is that each person holds that power of recovery within them. And all my role is to just say, look, there's a different way of thinking about this. Does it make sense to you? If it doesn't, that's fine. Like, you've got to meet people where they're at. People have got to find the path that makes sense for them. But if you sort of say something that does lead on to, help people to view things in a different way and have a different perspective, then I think that can be helpful. And again, that's why I think that the patient voice is so much more powerful, because I think it just makes more sense hearing it from people who've had first-hand experience.
So you're talking about how all of our voices, us who are living this, recovering, does have power, does have impact. So I know it's too early to really say anything definitively about this at all, but you and I had some kind of preliminary discussions about what we could do, what could be done with some of these recovery stories that are happening on my channel, and what the potential is for that to impact research or publications. So I just love to hear kind of, for you to share with people what you were thinking about exploring for that.
Yeah, so the literature on recovery in ME CFS is there's surprisingly little about it actually, and I think it'd be incredibly powerful to collate the work that you've put together and have a look and see if there are themes that we can pick out for people that have recovered. Because one of the reasons I contacted you is that the things you were talking about that help people to recover were the same types of things that I was seeing that seem to be kind of like making it harder for people to get better. And so I think to have a look at that from a more formal research perspective would be a really powerful thing. And I've actually contacted some of my colleagues to think about whether we could have a look at doing that and publishing that in an academic journal. Just to add even more legitimacy, I think for patients, I think exactly the formatting is absolutely perfect. And I link your YouTube channel to my patients all the time. But I think from that sort of clinician perspective, like how can we move this into the mainstream from a kind of clinical perspective, I think that kind of publication in academic journals could be a really powerful way to go and way to think about this.
I have goosebumps. It's just the thought of it, the potential is just people watching, right? Is that not incredible? So yes, we'll keep you posted. Hopefully we can get things moving on that. And then, so you just mentioned, what I'm seeing through recovery stories versus what you're seeing is effective for recovery, which we haven't talked a lot about. So once you're looking at that hardware versus software issue, what does that mean? Where do you go from there?
Mm-hmm. Yeah. So, I mean, that's exactly right. So when I talk to people about this in my clinic, and, if they really get it, and they say, yeah, it makes sense, I can understand how activated warning systems might be producing these symptoms, and they're internal systems, they're not my thoughts. What do I do about it? And that's obviously that's the sensible question. And I think the answer to that is a little bit nuanced, and it's where I think we start to understand that. I think one of the key points that I've seen in your videos is this idea that recovery starts when you realize that medicine doesn't have the answer, right? And so, and I absolutely agree with that. I think that medicine sometimes gets in the way. So medicine can actually make things worse, because what happens is that people start seeing lots and lots of different doctors, have more and more tests, and all of those tests, they're activating. Like if you have a test that produces anxiety, any sort of test does. And so if you go and have a blood test, you wait for the results, and then maybe they tell you there's something a bit wrong. If you do a blood test, there's a 5% chance that it's going to be abnormal, just by the way the tests work. And all those things, they activate warning systems. I call that the churn, And so when we think about recovery and what we do about it, I think what we have to do is, basically, we don't have pills or surgeries for it. And the reason for that is because the things that can activate your warning systems are unbelievably complex. So they're more complicated than medicine understands. So we can't just open your head and rewire your internal programming, because we don't have the technology to do that. And so what we do is we reverse engineer it. So we know the types of things that can cause dysfunctional warning systems. And so what we can then do is, by understanding that, we can... the cat's scratching on.
Yeah. This is triggering some sort of warning system in me right now. Yeah. Blue, stop trying to dig a hole through the couch. Yeah. Blue.
That's that.
Sorry, keep going.
Yeah, so look, we can reverse engineer that. So for example, we know that things like adverse childhood experiences can predispose people to having activated warning systems. We know that, for example, being illnesses, so the classic example is a complex regional pain syndrome. So you're in a car crash, you break your leg, that activates all your warning systems, and then the body heals, because that's what the body does. This principle, the body will heal itself, but the pain never goes away. And the idea is that warning system sort of got stuck on. So what we do is we look at those factors that are activating warning systems, and then we try to essentially break those positive feedback cycles that are causing the activation. And so I call it like turning yourself on and off again. So when your laptop's got a software problem, you turn it off and on again, and we reset it. And what we're trying to do is we're trying to reset all those warning systems. And there's a range of ways we can do that. Broadly, I talk about top down and bottom up. So the internal warning systems are not the same as your thoughts, right? So they're an internal warning system, but the things that we think consciously can impact them, because our brains are very, very complicated. So sometimes just understanding this new science and understanding that your body is actually safe can play a role in stopping that positive feedback, because basically symptoms are dangerous to us. So you get ill, that activates your warning systems, that causes symptoms, and then the fact of the illness feeds back and further activates the warning system. And so what we can do is try and break that positive feedback cycle. So Howard Schubiner, he's a physician in America who does a lot of work in mind-body medicine. He talks about 5 Fs, and essentially what they are, they're things that people do naturally to manage severe illnesses that inadvertently feedback and further activate the warning system. And so when we can think about these sort of patterns that we're adopting that might actually, we're doing it to try and help ourselves because we're ill, and that's completely understandable and natural, but it's having the opposite consequence. So he talks about, so the first is fear. So fear of the illness, what's wrong in my body, what's going on, why does no one know what's wrong with me, this is an unknown disease. All of these things are activating. The next one is focus, so excessively focusing on the symptoms, so keeping symptom diaries or thinking, am I better today or worse today? And that plays a role because your brain is constantly surveying for danger, and if you're increasing that surveillance, then the symptoms can get worse. So I always say to people, if I said to you, you're completely safe unless your big toe starts itching, and you lie in bed at night like thinking about it, eventually your big toe is going to start itching. That's how our brains work. That's what they do. So sometimes that focus on the symptoms can actually be activating, making the symptom worse. Next one is fix. So this is the constant searches for solutions, like trying different things, different papers, like that kind of battle, because every time we try something new, then we surveillance the symptoms more, then we've got this disappointment, it's not getting better, right? And so that constant churn and that constant cycle can also be activating. Next one's fight. So I call that white knuckling. All right. So you're saying, I'm just gonna beat this, I'm going to get through it. I think that's very important for symptoms like post-exertional malaise. Like I think that this pattern can help us to understand that, because what's happening is your brain thinks that you're unsafe for multiple complex regions, and you're saying, I'm not listening to that, I'm just going to get on with it, right? So you go out and do stuff, then your brain is going, well, they're not listening to me. So what am I going to do? I'm going to turn that signal up even more. So that kind of white knuckling, fighting the illness, can sometimes make things worse. And the last one is frustration. So I call this faith, my own F. I don't mean religious faith. I mean this deep down feeling like everything's going to be okay. Because I think sometimes if you've been ill for a very long time, you've been seeing lots and lots of people, like doctors, physicians, forums, and people aren't getting better, you can start to lose hope. And for me, these are real things: love, hope, and faith. Like I'm not religious, but these are real things. These are real human things, and they have an important role to play in our human health. And so sometimes when we think in more broadly about these illnesses, we can understand how, if we lose that hope, it can actually be further activating our warning systems. And so that's why, again, that brings us back, these recovery stories just so incredibly valuable, because to see somebody who's recovered and have that deep-seated, I call it basic trust, because I think faith can be difficult for people. We've got basic trust. It's like this idea, like I am in the right place, in the right time, in the right way. That calms your warning systems. And so the things that we do, they're going through like multiple levels of from the most simple things like being in nature and like calming your warning system, all the way through every level to having that purpose and that meaning in your life, and feeling like you're moving forward positively in a way are. It's actually quite hard to describe. I think you know what I mean, though, Raelan, I'm sure. But
So I know you and I talked before briefly about post-traumatic growth or what recovery means, kind of a returning to normal. What is your take on that?
yeah, so I've been thinking a lot about recovery and what that means. And I think that there's an analogy with the work that's been done on grief. So for me, I think that for people with very serious illnesses, there's an element of grief because you're grieving for the sort of person that you were before, right? So some people have sometimes lost everything, through these illnesses, and I think that there's the grief is actually playing a role in the presentation of the illness and people's journeys of recovery. And I think there's these typical 5 stages of grief that people talk about. So there's like denial and anger and depression, and I think if you're going through, I think people with serious illnesses go through exactly these same patterns. And I think if you're in a stage of anger, that's not very good for recovery. If you're depressed, obviously you're not going to recover well, and people obviously feel these things because they have lost such a huge amount very often. And traditionally the final stage of grieving was acceptance, right? So it's like, this is where I'm at, I can be peaceful with it. And that's something that has been a sort of trend in the field of things like chronic pain, where people stop talking about recovery and they start talking about living well with pain, living well with these conditions. But actually in the field of grief, more recently there was a 6th stage added, and that 6th stage was meaning. All right, and the idea is that you're no longer. It's not that you're missing the person that you've lost. It's like you're carrying them with you, and that journey you went through had purpose for you, and that death had meaning and meant that you showed up in a different way. That was part of your personal journey. And I think exactly the same thing happens with these types of illnesses. And that's why we talk about a personal journey, is that actually the person you are when you've recovered is a completely different person than you were pre-recovery. So it's not about getting back to where you were before, because that can never happen. It's about incorporating that experience that you went through and understanding that is the reason you are the person you are now, and that has beauty in it and meaning in it. And it's a very hard thing to get your head around, because if you talk about loss and you say, I partly got interested in this work because I had a son that I lost, and at the same time that I was moving from A&E into GP, and it totally changed the way I was thinking about things. And I went through a person, I didn't have a kind of a diagnosis of a functional illness, but I had a massive change in my whole understanding of my whole being. And it's almost like you don't regret that I lost Barney. It was his path and my path, and that has meaning for me, and that's quite and there's beauty in it. Like, all grief is comes from love, like, and there's so much love in that. When you hear your recovery stories, you well up because they're beautiful, right? And so it's very hard to say I've been seriously unwell, like sometimes for decades, and there's real beauty in that. And so for me, like, this kind of idea of that kind of journey of recovery, that hero's journey, I think is such a valuable thing, but it's quite difficult to, I don't know, I guess it comes from in here. It's not here, it's like in here. And when you feel it, it sort of clicks and makes sense, but it's not something that translates very well into Western medical approaches to recovery. I don't know if that kind of answers the question.
Yeah, it echoes what I hear from a lot of people who share their recovery journeys, that, they've come through it with almost a sense of gratitude, which is a very tough thing to say about such intense suffering. Doesn't mean the suffering wasn't horrible, but it is, I used to wonder, when I get through this, how am I going to put down all this trauma, because that's what it was for me, and just move on with my life. And then also, when I did set it down, did it mean that none of that ever happened? It was almost a hard thing to let go of, because it was, such an intense part of my life. And I think, at least that's what I'm hearing a bit from what you're saying, is that you carry this with you. Those
Absolutely.
Different versions of yourself come through. It all has meaning. It's all a part of you, and it's all still with you. And even though it was intensely painful, there are, there's goodness that comes from it that we carry with us.
And you learn from it, and you grow. Like, it's exactly, post-traumatic growth is exactly the right word. Like and then it's almost like you. So the classical hero's journey, it's this, you like descend into the underworld. So you have a structure of your understanding of how things are, and then something happens that sweeps it all away. Like something catastrophic happens, and suddenly, like, everything you thought you knew about you and the world, like, doesn't make sense anymore. And so then you sort of descend into chaos, and then you have to reconstruct it and and make a whole new kind of map of who you are and what the world is like. And then when you come back, like, you use that to help other people and show other people the way. And that's such a common theme I see, that people that have recovered from these illnesses go into doing something in this field. And I guess there's a bit of a bias on that, because I guess I come across the people that are working in the field. But I think finding that meaning and that purpose is all part of it, and it can be a difficult thing, especially when you're really ill and you're in pain, and like, it can be an incredibly hard thing to be able to rationalize and understand, I guess.
I think that's beautiful. I've never heard the hero's journey explained that well. I think that's so great, because I think that just really summarizes everyone that I talk to. It's, you kind of sometimes dip down into the depths of hell, but it is your growth journey. It doesn't always have to feel that way. It's not like every day you're going to be like, yay, suffering. I'm going to be a hero at the end of this. But at the end, most of us come through it, not returned back to our baseline, but in such a much better place than we were before, which is pretty incredible.
I guess one thing I would like to say is, you got to be a little bit careful that if you don't recover, because of the language, you'll be so careful about language. It's like, it's not that you're not a hero if you don't recover, because we don't know like what's going on. So part of it was also being able to, if you're on the journey, to be compassionate to ourselves if we're not getting better. So I think we have to be so careful with the language that we use, and because I think I don't want people to feel like, well, do you know what, like, I'm not getting better, so maybe there's something wrong with me, because it's not what this is about, really, because you don't know where you're going to be, and we don't know where the symptoms are. You may still have symptoms, and like, that's okay, but you still, I guess, like, everyone's finding their meaning and their purpose, like, irrespective of where they're at in terms of like what they can and can't do in terms of symptoms. So I guess it's just being a little bit cautious about that. Just love and compassion, no matter where we are in that journey, and being able to approach that with love, and not beating ourselves up if we're not getting where we thought we wanted to be, I guess.
Yeah, that's a really important point, and something that actually is coming up a lot in the people that I talk to. Even just the word recovery itself can be problematic, or your recovery journey, because it sort of implies there is an endpoint, like a specific finish line that everyone must cross, and then we move on to utopia. And that's obviously not how it goes. People reach various places on their journey, and what is full recovery? Does it exist? And then, do we feel stressed every time we don't feel well? Does that mean we're no longer recovered? So yeah, I think that's a really important point, that it is all just the journey, and wherever you're at on it is where you're at. And there's and
it never ends. Like, we're always working on ourselves all the time, and like I've had like loads and loads of therapy, but I'm still like, I don't know, I have to have some more after this interview, because I feel, oh God, what did I say? But like, I guess the point, you're constantly working on it, aren't we? That's just the nature of.
Yeah, I really appreciate the sensitivity with which you approach all of this, and just the compassion for people, and just really trying to be inclusive and understanding and accepting of just all the different places that people are on this journey. So yeah, I'm sure that people watching, that will mean a lot to them. If people watching, as I'm sure they will, want to learn more about you, or learn more from you, or get in touch with you, what's the best way for them to do that?
Yeah, so I have a little podcast that I made. So actually, it's not about ME/CFS. Actually, it's I wrote it pre-pandemic, essentially for patients that were just coming in to see me just in normal 10-minute GP consults, that were just feeling like feeling tired all the time, and we do blood tests and they're normal, but not really unwell people. So I've got a little podcast for that. I guess the most recent episodes, there's 3 episodes all about chronic pain, which perhaps are more relevant to people with ME/CFS. I think the earlier stuff, it's sort of it's more just sort of about lower level stuff. So you can check that out if you're interested in it. You can contact me. My website is cambridgeprogressivemedicine.com, and you can message me on there. I don't do a huge amount of social media. But,
amazing. And of course, all of this will be linked in the video description. So I really encourage you to expand that and take a look at what's there. Thank you so much, Dr. Bostock. I've appreciated every sentence that you've said in this interview. I just think this is such great stuff. I appreciate your time. I appreciate all the work that you're doing with people. And I'm just so glad that you exist and that you're out there for people. So thank you so much.
Well, absolutely the same to you. As I said, I very frequently signpost my patients in my long COVID clinic to your channel. I think you've been doing amazing work. So exactly the same. Thank you so much for everything you're doing, and hopefully we can work together and get some get an academic paper done.
Yeah, even just personally, selfishly, or I'm sure people watching can relate, it's a very validating thing, because for many years I felt by some doctors at least a little bit dismissed. So now I'm in this place. I love where, people are open to hearing what us, the patients, have to say. And I just love, it feels like there's a bit of a shift happening with the, sort of the open-mindedness and the humility of doctors like yourself willing to talk to someone without any medical training like myself, and just saying, maybe there's something in these recovery stories that can be of value. So yeah, very much appreciated.
Thank you very much. Can I just do one very little plug?
Of course.
Because I guess I think the stuff I have out isn't perfect, I guess, because it's written for a different purpose. But there is some fantastic resources out there. So in America, there's something called the PPDA. So their website, we could put a link, I guess, for it. They do lots and lots of work for mind-body medicine. Howard Schubiner already mentioned his website as well. We can put a link for. He's got lots and lots of resources for understanding this work. In the UK, there's Living Proof, an organisation set up by a colleague of mine, Penny George, and also an organisation called SERPA that does a lot of work for mind-body medicine. So I guess perhaps we could put those links for those things that people might find helpful underneath, if that's okay.
Absolutely. They're there.
Very good.
Very helpful. Thank you so much. Well, thank you again, Dr. Bostock. Thank you to those of you who are watching. I am so excited to see what your thoughts are about this video. So please leave it in the comments. Please share what resonates, anything else out there that you found that's helpful. And if this sort of topic and concept is resonating for you, I'll link a video up here that does a bit more of a deep dive on the whole mind-body healing approach, and shares one exercise for you to consider that may potentially be helpful for you. So thank you for watching. I hope you got as much out of this video as I did. I hope you enjoyed it, and I hope to see you in this next one.